What is family adoption program? Anybody can tell.
Sir, it is a program launched by especially Indian government to build a connection between the health communities with the rural people, and we go in this program and ask about their well-beings and health cares.
Please clap for her. So family adoption program, basically we are gonna adopt a family and we will care them time by time, we will visit them time by time, and during 5 years course you will adopt this family. Every single of you will adopt around 3 to 4 family. Okay. So it aims to provide an experiential learning opportunity to Indian medical graduates towards community-based healthcare and thereby equity in health. It's recommended in community medicine subject and should begin from first professional year with the MBBS training program. Next. So we will visit a nearby family which is not covered by under PSC or RSTC. So what is PSC? Anybody can tell?
Yes, sir. I'm from Bolpur Shantiniketan. So there are 2 of PSC, Bolpur Healthcare Centers, right? So primarily there are one teacher, one doctor, one main doctor, and others healthcare staffs. So many healthcare staffs, nurses, not nurses, mainly healthcare staff, ASHAs, and male healthcare staffs also in there. मतलब अगर फीवर है या फिर छोटा मोटा अगर कोई एक्सीडेंट हुआ है उसमें अगर टेट बैक लेना है या तो फिर फीवर का वो मेडिसिन लेना है, और अगर छोटा मोटा एक्सीडेंट हुआ तो बोला ही मैंने टेट बैक के लिए, मतलब छोटा मोटा अगर कुछ हुआ है बॉडी में कुछ प्रॉब्लम्स है तो पीएचसी में ज़्यादातर जाते हैं, मतलब बहुत ही रैंडम छोटे मोटे कुछ प्रॉब्लम्स है। अगर ज़्यादा बड़ा प्रॉब्लम है तो हॉस्पिटल में जाना पड़ता है। ऐसा।
So now everybody knows what is PSC. So you tell what is PSC.
So PHC is basically like a small medical facility where we provide the basic medical care to the patients, not the extraordinary ones. So we will refer them to the main hospitals if the case is severe, and the basic treatment is available over there.
So in India we follow the 3-tier system, health system in India. Primary, secondary, tertiary. So in primary, the primary healthcare itself, and the first point of contact for any village families is sub-center. We will visit a sub-center, then we will see what sub-center is. The first contact point is sub-center. After that, PSC. After that, everybody please write down. The first contact point is sub-center. After that, PSC, primary healthcare or primary health center. After that, CSC. After that, district hospital. Up to this is secondary. After that, tertiary care hospital. What are the tertiary care hospital in Tripura right now? How many tertiary care hospital in Tripura right now? Anybody from Agartala? Bolo.
ILS,
1,
GB,
2,
IGM,
and TMC.
TMC.
And in future, TSMC will be one of them. So medical students may be divided into teams, and each teams may be allotted visit 3 to 5 family per student. So we are supposed to visit the families right now, but the management told that everybody should come. After that, we will go. So what was the time of last counseling date? Last admission date? November. আচ্ছা, তো সবগুলো শেষ হতে হতে কবে?
2 মাস।
আরও 2 মাস। So after 2 months only we'll have to go field visit. So the field visit will be fun. You will go by bus, then after you will go to the families and tell them. So today we have to spend time, 2 hours.
So let's play something.
What?
Let's do something like sports.
Yes. It's not like sports. You have to do in the class only. Okay. So after 2 hours, I'll leave you, and then you'll go out. And so during the visits, you have to interact with the families, and details will be documented, and you have to present in PowerPoint. After visiting the family, 3 to 4 visits, then you have to present it in a PowerPoint. Anybody knows PowerPoint? Everybody knows how to make slides. So the main objectives of the family adoption program were, during UG training program, the learner should be able to orient and learn towards the primary health care, create health-related awareness within the community, function as first point of contact for any health issues in the community. So you will be the first point of contact in the communities after adopting the families. So you can read what are the benefits for students and for families. So we'll see what health camp is and what are the things in health camp they do. Okay. So in first professional year, the first thing we'll learn is how to develop your communication skill, how to talk with the patients, how to talk with the families. So we'll see. So the core competencies to be developed through FAP is, first is empathy and communication. Please read it from the slides.
Empathy and communication. Interaction with the adopted family will encourage active listening, effective communication, and empathy, enhancing the medical student's ability to understand patients' concerns and collaborate on treatment plans. Empathy is the ability to understand and share other people's feelings. It's a core concept, as according to the psychodynamic, behavioral, and person-centered approaches, it facilitates the development of a therapeutic relationship with the healthcare user, providing the basis of therapeutic change.
Understanding the dynamics of the rural setup of the area. By participating in different screening programs and generating awareness about national health programs, medical students will learn about the Indian healthcare delivery system at the grassroots level. Community participation is a key factor that enables effective health system functioning and is the first step towards true community empowerment in health. This is one of the founding principles of PHC since the Alma Ata Declaration 1978. This principle reflects the underlying value of social justice and improving health, especially in deprived areas, to the involvement of the community in the planning and implementation of activities towards building a healthy society.
Cultural competence. Exposure to diverse familial backgrounds improves the medical student's cultural sensitivity, thereby reducing disparities in healthcare and fostering a culturally competent approach to patient management.
Community engagement. Through the family adoption program, medical students will actively engage with the community by organizing health checkup camps, coordinating treatment of adopted families under supervision, maintaining communication and following up, promoting health awareness, and building trust between healthcare providers and patients.
Understanding social determinants of health. Understanding the socio-demographic and environmental profiles along with socio-economic factors influencing health outcomes enables medical students to address underlying causes and often targeted interventions, contributing to better health equity.
Social responsibility in the form of environmental protection and sustenance activities. Under the family adoption program. Students will take part in the plantation and its maintenance and will help to take proper remedial measures for water, sanitation and hygiene.
These competencies will be acquired by a medical graduate throughout 3 years, first, second, and third professional Part 1 MBBS, and assessed at the end of the third professional Part 1 year.
Health promotions and disease prevention. Community medicine emphasizes preventive medicine and health promotion. Integrating these principles into the FAP can acquire learners with essential skills to identify and address the health risks within the families and communities proactively.
Benefits of family adoption program: enhanced patient care. The family adoption program nurtures a humanistic perspective, leading to improved patient-physician relationships and patient satisfaction. Personal and professional growth. Family adoption program provides medical students hands-on experience in community-based healthcare, where they develop emotional resilience, problem-solving skills, and adaptability. This fosters all-rounded physicians prepared for complexities of healthcare.
Community impact. By immersing themselves in the community, medical students can identify and address local health needs, positively impacting the population's health and well-being.
Conclusion: the FAP integrated into the CBME-based curriculum proposed by the NMC represents a transformative approach to the medical education. By nurturing compassion, cultural competence, and communicative and engagement, the FAP empowers medical students to become proficient and compassionate physicians, equipped to meet the healthcare needs of a diverse and evolving society.
Introduction. The family adoption program is an essential component of community-based medical education. It aims to provide medical students with first-hand exposure to community health problems. The program bridges the gap between theoretical learning and real-life public health practice.
Objectives of the program: to develop an understanding of social determinants of health, to build empathy and communication skills among medical students, to identify health needs and risk factors at the family level, to promote preventive, promotive, and curative healthcare practices.
Methodology. Each student adopt one family in shape of village were visited regularly to collect health, social and environmental data. Each education and counseling were provided as per needs. Follow-up visits were conducted to monitor health outcomes.
Study area: village, a semi-rural community located near Tripura Shantiniketan Medical College. Population approximately 1,500 residents. Main occupations: agriculture and small-scale business. Limited access to advanced healthcare facilities.
Data collection. Household survey use structured questionnaires. Parameters include demography, sanitation, nutrition, immunization, chronic illness. Study maintain families' health folders for record keeping.
Key observations: common health issues, malnutrition, anemia, hypertension, diabetes, inadequate sanitation and limited health awareness, high prevalence of tobacco and alcohol use among adults, positive community response to student involvement.
Health education and interventions, conducted awareness sessions on hygiene, nutrition, and immunization, encouraged antenatal checkups and institutional deliveries, promoted safe drinking water and hand washing practices, assisted in linking families with government health schemes.
So anybody knows what is antenatal? Antenatal care? Anybody? What is antenatal? What is postnatal?
Learning outcomes for students: improve understanding of family and community health structure, develop communication and counseling skills, gain experience in data collection and analysis,
and realize the importance of empathy and patient-centered care.
Challenges faced: communication barriers due to language and cultural differences.
Barriers for outside of Tripura people. Language barrier. So you have to learn the local language.
Yes, sir.
Okay. By help of your local friends, you have to learn.
Yes, sir. Irregular follow-up due to family migration or unavailability. Limited resources for intervention. Difficulty in changing established community behaviors.
Conclusion: the family adoption program effectively integrates community exposure into medical education. It strengthens students' understanding of public health principles. Continued engagement will contribute to sustainable community health improvement.